First, we have the drawing syringes for the testosterone. We also have the testosterone. We have the insulin syringes for the gonadorelin. And please note, everything in here is for a 2-month supply. We have 2 bottles of gonadorelin. We have the injection needles for the testosterone. And we have 4 100 milligram sildenafil tablets, which is the generic form of Viagra. Next, we will show you how to inject testosterone. These are all the necessary items that you will need to do testosterone injection. We have our injection needle, we have our drawing syringe, we have the bottle of testosterone, and we have 3 alcohol prep pads. So the first thing that we'll do is we will clean the top of the bottle in order to make sure that it is sterile and not contaminated in any way. We can do this by rubbing the alcohol prep pad on the top and on the sides as well, if you so wish. Now we will take the drawing syringe and we will insert it into the rubber stopper at the top. We will turn the bottle upside down and we will draw our prescribed amount. In this case, it is 1/2 of a milliliter. And you can draw a little bit past and then push back up to get the air and make sure that it is the correct amount. Once we have done that, we can pull back a little bit to get all the testosterone into the syringe, and then we will switch to the injection needle. We'll get the cap back on here and twist off the top. Now we will add the injection needle to the syringe, and we are ready to inject. I'll give you some extra steps here in just a minute. Now that we have our testosterone drawn up, we're going to inject it into our thigh. And the way we're going to find the best spot is by making a line down the center and a line across. And this upper quadrant, or what would be considered the pants pocket area, is the best spot to do the injection. So what we're going to do is we're going to take one of our alcohol prep pads, and we have another one ready for after the injection, and we are going to prep the area by going in smaller circles and then moving to larger circles to cover the entire area. And while that's drying, what we can do is we've switched to our injection needle, and you can see there's a little bit of air in there. So what we're going to do is push up a little bit until we see a drop of testosterone coming out. That just gets rid of all the air. And I'm just going to let the alcohol dry for another second. And what we're going to be doing is we're going to be going in a straight motion, straight directly into the leg, and then we are going to be pressing firmly but not too fast. There's no reason to rush this. So we're just going to go right here. Before we finish explaining the testosterone injection process, we want to make you aware of something called aspiration, which is optional. Now aspiration, once the needle is inside your leg, you would apply some slight backward pressure on the plunger. Now, most of the time you're not going to see anything, but sometimes if there is a little blood that comes into the syringe, what we're going to do is remove the needle. We are going to clean the area with an alcohol prep pad. Then we are going to remove the old needle, and we're going to get a fresh needle. And now we can start over in a different spot, using the same process that we've explained in this video. So now we'll finish up with the testosterone injection. And we are going to press firmly. and we're going to keep injecting until all the medicine is gone. Now that all the medicine is gone, we're going to pull directly out, and we are going to get our second alcohol prep pad, and we are going to clean the area. This particular injection did not bleed at all, but if you do see a little blood, that's perfectly normal, nothing to be worried about. Just use a clean alcohol prep pad to clean the area, and now you're done with your testosterone injection. Here is everything necessary to do your Gonadorelin injection. We have our insulin syringe, we have the bottle of Gonadorelin, and we have 3 alcohol prep pads. So what we'll do is we'll take our first alcohol prep pad, and we will clean the rubber part of the stopper at the top of the bottle to ensure that it is clean and sterile, which is very important. Now we will take our insulin syringe, we will take off the top and the bottom, and we will insert the needle into the top of the vial of Gonadorelin. We will turn the bottle over and we will draw our exact dosage. In this case, it is a half a milliliter or 50 units. But please be sure to read your prescription bottle so you dose exactly as stated. Once we are at the 50 unit mark, we will remove the syringe and we are ready to inject. So now that we have our Gonadorelin drawn into the insulin syringe, we're going to inject it subcutaneously into belly fat. And the ideal spots are about 1.5 inches from the side of the belly button on either side. But try not to get close to the belly button. And also, we're going to squeeze the skin a little bit when we do the injection. And we're going to inject the needle cleanly and in a swift but direct motion. So we have one alcohol prep pad that we're going to use to clean the area, and then we have another that we're going to clean the area afterwards. So we are going to use the alcohol pad in a swirl fashion to clean the area thoroughly. Remember to be as clean and sterile as possible while doing this. Now we're going to let that dry for a little bit, and while I do, I'll show you that we're going to go, like I said, about 1 inch, 1.5 inches, 2 inches, roughly in this area to the side of the belly button. So we're going to remove the cap, and we are going to pull a little bit of skin, and we are going to go in a smooth, nice and direct motion, and then we are going to inject firmly, but not too fast. Just a nice smooth motion, no rush. Once we're done, we can let the needle sit there for a minute or two, just to let everything absorb into the fat. Once we're done, pull out directly, straight out, and now we will use our second alcohol prep pad to clean the surface. And that is how you do your Gonadorelin injection.